Good day, everyone. We are Group 4 and we're going to discuss one of the basic and major bioethical principles: principle of totality for the basic and beneficence for the major. So, totality refers to the responsibility of preserving the physical component of human life's integrated physiological and spiritual existence. It means all of the body's organs and other parts exist for the sake of the whole person. Since a part's goal is to serve the total, any activity that harms or inhibits a part of the body from accomplishing its purpose is against the natural order and ethically wrong. However, it is considered acceptable to sacrifice the loss of a bodily part for the greater welfare of the individual and preserve their life, even though it could also limit them to perform other activities. Take amputation, for example. Let's say a patient was admitted to be severely hypothermic, their feet having submerged in icy water suffered severe frostbite damage. As the patient was admitted to the intensive care unit, they initiated internal rewarming. It involves extracorporeal membrane oxygenation and cardiac bypass. After their medical condition had stabilized, the focus shifted to the patient's lower legs. Plastic surgeons inspected and treated their wounds, recommending hyperbaric oxygen therapies as well. However, these attempts failed and the patient developed stable dry gangrene in both lower extremities. Hence, the patient needs to undergo amputation. Though the patient was hesitant about it at first, since they work as a personal trainer and circus performer, thus affecting their lifestyle. Eventually, they decided and signed a standard hospital consent form and underwent bilateral below-knee amputations after discussing the benefits, dangers, and options with their family.
When it comes to organ donation, it saves lives for patients who have been on the wait list for so long, while transplantation improves the outcomes under circumstances, thus decreasing recipients' waiting time. Transplantation of organs also appears to be a breach of the first ethical rule of medicine, primum non nocere, above all do no harm, since it removes a healthy organ of one person and integrates it into another individual, though it is ethically permitted provided that it does not violate nor damage any fundamental physiological function. The expected benefit to the receiver is relative to the donor's detriment. As such, the purpose of this could be acceptable by the principle of fraternal love or charity, since it limits the harm to the donor. While some ethicists argued that it did not contradict the principle of totality as long as the body's functional integrity was not adversely affected, even it compromises some anatomical integrity. However, it's not ethical and justifiable for a person with two functioning eyes to donate to someone to enable a blind person to see, since one's ability to see or the functional integrity would be seriously impaired. Unlike when donating one of one's kidneys may be ethically acceptable for proportional consideration because one can function with one healthy kidney.
Next is the principle of beneficence, which is the physician's commitment to act for the patient's benefit. It underpins a set of moral standards to safeguard and defend the right of others, eliminate situations that may cause detriment, assist people with disabilities, avoid harm, and save those in danger. These commitments are universally acknowledged as the legitimate aims of medicine and are seen as reasonable and self-evident. This notion lies at the heart of healthcare, meaning that a suffering patient can engage in a relationship with a physician whom society has certified as competent enough to offer medical treatment, knowing that the physician's primary goal is to assist.
To further comprehend the principle of beneficence, let's take into account the scenario. A child patient has been admitted to the hospital with a significant open fracture to their left leg. The limb is deformed with serious bleeding, and the patient is extremely distressed. The parents are demanding immediate action be taken. So there are several treatment choices available, but let's start with the most extreme, the amputation. If the bleeding is life-threatening, the limb sufficiently injured, and the risk of infection extremely high, then amputation could be a treatment option. It will be beneficial to the patient in that the damage will be resolved and the risk of death from bleeding or infection will be lowered. However, in contemplating the consequences of amputation, the treatment will cause permanent harm and the dangers of infection or major bleeding are out of proportion. But then again, there are other procedures with superior outcomes that are accessible to us. Better results for this patient will be achieved by using blood products to control the bleeding, decrease the fracture if possible, and perform orthopedic surgery if necessary. These methods are more good than amputation. It's a severe example, but it demonstrates an essential point. Beneficence obligates us to encourage a path of action, but in practice, we must also promote some courses of action if better alternatives are available.
The next case scenario is a conflict between principle of beneficence and respect for autonomy. In this situation, the healthcare providers employ a paternalistic approach while caring for their patients whether on purpose or unintended, as they deem that it is beneficial for their patients. Although the intervention appears to be useful to the patient, it actually infringes the autonomy of the patient by contemplating the right of their decision in the treatment. Situations like this necessarily require healthcare professionals to critically analyze the risks and benefits associated with the choices they make, including its consequences that should be taken into account, well discussed, and planned so that the decision made promotes maximum beneficence and minimal or no harm in terms of autonomy. One clear example of this conflict exists in healthcare where the principle of beneficence is given priority over the principle of respect for patient autonomy. Like when there is a disabled patient by grave nature of an accident or illness, we conjecture that a reasonable person would want to be treated aggressively, and we rush to provide beneficent intervention by controlling the bleeding and mending or suturing the wounded. In our society, a physician is a paternalistic when they are compassionate in providing beneficent treatment that they believe is the best interest of the patient without consulting them or overriding their wishes. The most explicit case of justified paternalism is seen in the treatment of suicidal patients who are a clear and present danger to themselves. In this case, the physician's duty of beneficence demands that they intervene on behalf of preserving the patient's life or placing the patient in a safe environment in conviction that the patient is compromised and cannot act on his account at the time. As usual, the circumstances of case are critical in determining whether the patient's autonomy is compromised. Here, the principle of beneficence and the principle of autonomy is in conflict. The weighing of factors. First, the patient may not be making a decision in his best interest because he is incapacitated due to the accident that happened, and no one else can give an immediate consent. And second, the severity of life-threatening illness and the urgency to treat to save his life supports the decision in favor of beneficence.